Our eyes are amazing. They move quickly and smoothly, letting us see the world around us. Did you know that 3 important nerves control these eye movements? We call them cranial nerves. These nerves act like electrical wires, sending signals from the brain to the eye muscles. The oculomotor nerve, which is cranial nerve 3, the trochlear nerve, cranial nerve 4, and the abducens nerve, cranial nerve 6, work together as a team. They make sure our eyes move together in the right direction. Imagine trying to read if your eyes couldn't focus or follow the words on the page. In this essay, we'll learn how doctors examine these important nerves. Understanding these exams helps us keep our eyes healthy and spot any problems early on. Examining the oculomotor, trochlear, and abducens nerves is a crucial part of a neurological exam. Why? Because these tiny nerves can reveal a lot about our overall health. Problems with these nerves might be the first sign of a serious medical condition. Think of these nerves as tiny alarm bells. When they're not working properly, it can be a warning sign of increased pressure inside the skull, brain tumors, strokes, infections, and multiple sclerosis. By carefully checking these nerves, doctors can catch these problems early on. Early detection often leads to better treatment outcomes. The oculomotor nerve is like the busiest air traffic controller of the eye, managing multiple functions. It controls pupil size and reaction, telling the pupil to constrict in bright light and dilate in dim light. It also lifts the eyelid, preventing drooping, and controls most eye movements, including up, down, inward, and diagonally. To examine the oculomotor nerve, shine a light into each eye and observe the pupil's response. Both pupils should constrict equally. This is called the pupillary light reflex. Check for any drooping of the eyelid, known as ptosis. Then, ask the patient to follow your finger with their eyes without moving their head. Move your finger in an H pattern to assess all directions of gaze. The trochlear nerve has a very specific job. It controls the downward and inward movement of the eye. Imagine looking down at your feet or reading a book. The trochlear nerve is hard at work. To examine the trochlear nerve, ask the patient to follow your finger as you move it down and towards their nose. Then ask the patient if they see double vision when looking down. Double vision, or diplopia, can be a sign of trochlear nerve palsy. Weakness in the trochlear nerve can make it difficult to look down, especially when looking towards the nose. This can make everyday activities like reading or going downstairs challenging. Section 5. Looking side to side. Evaluating the abducens nerve, also known as cranial nerve 6. The abducens nerve is responsible for the lateral movement of the eye, moving the eye away from the nose. This nerve is essential for looking from side to side, like when you're watching a tennis match or scanning the horizon. Examining the abducens nerve involves 2 key steps. First, lateral eye movement. Hold your finger horizontally and ask the patient to follow it with their eyes as you move it from left to right and back. Second, observe for abnormalities. Look for any inability to move the eye outward or any inward turning of the eye at rest. Damage to the abducens nerve can cause the eye to turn inward, leading to double vision. This can significantly impact a person's ability to drive, read, or perform other tasks that require clear, coordinated vision. Section 6 Red Flags. What abnormal findings tell us? During the cranial nerve exam, it's important to note any abnormal findings. These findings could indicate a problem with the nerves or the muscles that control eye movement. Here are some common abnormalities and their possible causes. Unequal pupil size, known as anisocoria, can be a sign of Horner's syndrome, optic nerve damage, or a brain aneurysm. A fixed, dilated pupil is a medical emergency and can be caused by increased intracranial pressure, brain herniation, or drug use. Eyelid drooping, or ptosis, can be a sign of myasthenia gravis, a stroke, or a tumor. Inability to move the eye in a specific direction could indicate paralysis of the specific cranial nerve responsible for that movement. Double vision, or diplopia, can be a sign of cranial nerve palsy, thyroid eye disease, or other conditions affecting the eye muscles. If any abnormalities are detected, it's crucial to refer the patient to a neurologist or ophthalmologist for further evaluation and management. Section 7. Putting it all together. The importance of a thorough eye exam. Examining cranial nerves 3, 4, and 6 might seem like a small part of a physical exam. However, these tests provide valuable information about the brain and nervous system. These nerves are like tiny windows into the brain, providing clues about its health and function. A thorough eye exam, including an assessment of these cranial nerves, is essential for early detection of neurological conditions. Catching problems early allows for timely intervention and better outcomes. Monitoring disease progression. These exams help track the progression of certain neurological diseases. Evaluating treatment effectiveness. They help determine if treatments for neurological conditions are working. Remember, early detection is key. Encourage your patients to seek medical attention if they experience any changes in their vision or eye movements. Section 8. Keep learning. Empowering your clinical practice. Mastering the cranial nerve exam takes practice and attention to detail. The more you practice, the more confident you'll become in identifying subtle abnormalities. Here are some tips for continued learning. Review anatomy. A solid understanding of the anatomy of the eye and cranial nerves is essential. Practice on colleagues. Practice performing the exam on friends or colleagues to hone your skills. Attend workshops or conferences. Continuing education opportunities can provide valuable hands-on training. Stay updated on the latest research. The field of neurology is constantly evolving, so it's crucial to stay informed about the latest advancements. By continuously improving your skills and knowledge, you'll be better equipped to provide the best possible care for your patients. Remember, a thorough cranial nerve exam is a powerful tool that can help you diagnose and manage a wide range of neurological conditions.